I'm here with Vicken Karageozian from Allegro. Vicken, you've got really cool stuff. You know, we've talked about anti-integrin therapy that you've been working on in the context of the posterior pull of the retina. Vicken, you understand this is an anterior segment meeting, right?
Yes,
You're not
I
in
do.
the wrong place.
I know.
So what are you doing here?
Well, Josh, thanks for having us. Yes, Josh is right. This is the first time Allegro is presenting at an anterior segment conference. We do have an anti-integrin portfolio of compounds, and our main focus for the last several years has been Luminate for retinal applications in diabetic macular edema, and we also have an active program right now in dry macular degeneration. The reason that we're here today is we also have an expansion of this portfolio with ALG 1007 in dry eye disease. It's also an anti-integrin peptide. It's a topical eye drop that's robustly anti-inflammatory, and we already have human data that we're presenting here at ASCRS. So we're not in the wrong place, fortunately.
Vicken, so the management of the ocular surface has gone from being simple to being complicated to being like out of sight complicated now. Tell me, where does anti-integrin therapy fit in? What's the mechanism by which anti-integrin therapy would be beneficial in the context of ocular surface disease?
You're right, all of this disease process is pretty complicated. Where our portfolio of anti-integrin peptides fits in is that some of these compounds have very potent anti-inflammatory effects. Specifically with ALG 1007, the compound that we're talking about our human data here at this meeting, the anti-inflammatory properties of ALG 1007 stem from its activity as an anti-integrin for alpha-M beta-2 integrin. That means it gives you three features that are anti-inflammatory that are very important for dry eye disease. Number one, you get interference of leukocyte attachment, leukocyte migration, and also downregulate the complement 3 pathways. With all of this downregulation of inflammation on the ocular surface, that translates into a very nice improvement in the signs and symptoms of dry eye disease. That's how it fits together.
Now, you gave a little teaser about some anterior segment, some ocular surface data that you have with this product. Can you talk about that? Is it fair for me to ask you?
Sure, we can give you a little bit more of a teaser, if you will. So I presented at the OIS meeting here at ASCRS this morning, and we basically covered the fact that we already have completed an ex-US phase 1 proof of concept open label study in 40 patients with dry eye disease. These patients had to have dry eye disease for at least 6 months and have moderate dry eye disease. We also followed these patients for the typical 3-month duration and looked at all the signs and symptoms of dry eye disease. Without stealing Dr. Donenfeld's thunder when he's presenting the full data set on Monday, what I showed on the podium today was that you get a robust response with the objective signs of dry eye disease. I showed nasal conjunctival staining was strongly statistically significant, and also get a nice dose response curve as well. You'll have to see Dr. Donenfeld's presentation for the full data set, but it's robust across the board, both for signs and symptoms of dry eye disease.
Now, I of course tease you that it's an anterior segment meeting and all of that, and certainly you've got news in that sphere, but you also have some new posterior segment data too. Can you talk about that a little bit?
That's true. We've been very, very busy at Allegro lately. So while this front of the eye dry eye disease information just came out, and we've already started a phase 2 study in dry eye disease as well, moving forward in that, we also have an active retina portfolio. We have our US phase 2 dry macular degeneration data coming out in 2 months. It's going to be presented at the American Society of Retina Specialists by Dr. Kaiser in late July, and we're very optimistic about that as well.
Oh, wonderful stuff. Clearly a company on the move. This is great. I would love to ask you when I'm going to be able to use it, but I know you're not going to be able to give me any sort of solid answer, so I'm not going to ask
Hopefully
you that.
in the near future.
In the near future, yes. Very nicely said. Vicken, I want to thank you for bringing this cool news to us, and as always, for being so very generous with your time with us today.
And Josh, thanks again for having us. We really appreciate the opportunity to bring everybody up to date. Thank you.